Have you ever wondered if every medical test that's part of a routine checkup after turning 70 actually helps you? Or if some of them might secretly do you more harm than good? Most people believe the more tests, the better. But the truth is, after 70, certain health checkups for seniors can bring unnecessary risks, side effects, and even dangerous treatments. Let me give you an example. Tests that expose your body to radiation for no real reason, or screenings that find harmless conditions, things that would never bother you in your lifetime, but still end up dragging you into harsh medications, invasive procedures, or even surgery. And here's the scary part. Almost nobody talks about this. But when it comes to senior health, prevention, longevity, and healthy aging, this is information every older adult should know. That's why today, here on Elder Longevity, I'm revealing the 5 health checkups you should avoid after 70, because they might harm you more than help. This isn't an anti-medicine video. Not at all. It's an important reminder about smart aging, real prevention, and making the right health choices after 70. So before we begin, like this video, subscribe to Elder Longevity and tell me in the comments, where are you watching from? Let's spread the right information about senior health, prevention, and a long, vibrant life. And listen, make sure you stay until the end, because number 3 on this list, it's one of the most common tests doctors recommend, and it might shock you. Let's dive in. Checkup 1. Overscreening for low-risk cancers. This first one might surprise a lot of people, because most believe that every cancer screening is always necessary. But the reality, especially after turning 70, is not that simple. After 70, certain screenings like prostate cancer, thyroid cancer, or even breast cancer may actually do more harm than good for many seniors. Do you know why? Because these tests often detect tiny nodules, microtumors, or harmless changes that would never cause symptoms or threaten your health in any way. But once those results come in, fear kicks in, anxiety takes over, and worse, people get dragged into aggressive treatments, unnecessary biopsies, surgeries, and medications that might leave an aging body even weaker. And there's more. Some of these treatments increase the risk of infections, falls, loss of mobility, and they can even shorten your life expectancy. So, not every test means smart prevention. In fact, the most up-to-date medical guidelines warn that after 70, certain cancer screenings should be carefully considered, always focusing on quality of life and real benefits. So, before you rush into every test out there, make sure to talk to a healthcare professional who understands your age, your health, history, and most importantly, your quality of life. And tell me in the comments, have you ever suspected that a test recommended to you wasn't really necessary? I'd love to know. Also, if this video is surprising you, make sure to hit the like button, because checkup number 2 might seem harmless, but it could be a real trap for seniors. Stay with me. Checkup 2. Invasive heart tests without clear symptoms. This is another classic case where doing too much can be more dangerous than doing nothing. Many people over 70, even without clear symptoms or complaints, end up undergoing invasive heart tests like catheterizations, angiograms, or even extreme stress tests. So, what's the problem with that? When done without a real medical reason, these procedures can lead to serious complications, adverse reactions, bleeding, infections, and even an increased risk of heart attacks or strokes. On top of that, they often push seniors into unnecessary treatments, like strong medications or surgeries that might never have been needed if it weren't for that invasive test. And here's the scary part. Sometimes these tests are ordered more out of habit or protocol than actual clinical need. That's why modern medicine recommends, after 70, invasive heart tests should only be done if there are significant symptoms, like frequent chest pain, ongoing shortness of breath, or clear signs of heart disease. The right test at the right time can save a life, but the wrong test on the wrong person can lead to complications that lower your quality of life. And what about you? Have you ever heard of someone going through a test or procedure like this without a real reason? Tell me in the comments. And stay with me, because checkup number 3 is one of the most commonly recommended tests. But it hides a risk almost no one talks about. Let's keep going. Checkup 3. Routine colonoscopy without individual assessment. This is a well-known test, and yes, it does have its value. But after age 70, the story changes, and most people don't realize it. Colonoscopy is a key screening tool for colon cancer. But the truth is, after turning 70, and especially after 75, the risk of complications during or after this exam rises significantly. And we're talking about serious risks: intestinal perforation, heavy bleeding, adverse reactions to sedation. All of this happening in a body that naturally has fewer reserves to handle emergencies. On top of that, many polyps found in older adults would never have caused any real problems during their life. Meaning, this test often leads to surgeries or treatments that may have been completely unnecessary. That's why current medical guidelines are clear. After 70, the decision to do a colonoscopy should always be individualized. It must consider your overall health, life expectancy, medical history, and whether you have relevant symptoms. Just because everyone does it, or because a doctor routinely orders it, doesn't mean you have to go along without asking questions. Yes, colonoscopy can be helpful, but it can also bring unnecessary risks if done as a routine test without real need. Did you know about this? Tell me in the comments. I want to hear your thoughts. And don't go anywhere, because checkup number 4 involves a type of test that looks simple, but could be a real danger once you're over 70. Let's move on. Checkup 4. Contrast imaging tests in seniors with sensitive kidneys. This is one of those tests that seem harmless, but in reality, it can pose a serious risk after age 70. Imaging exams like CT scans, MRIs, or angiograms with contrast are commonly used for diagnosis. But few people know that the contrast dye used in these tests can be dangerous for those with reduced kidney function, something very common in seniors. Even if they have no obvious symptoms. For example, iodinated contrast can trigger a condition called contrast-induced NEPH. In simple terms, This means your kidneys can suffer serious damage, leading to kidney failure and, in some cases, even dialysis. And the worst part, this complication can happen in people who had no idea they had kidney issues. That's why the recommendation is clear. Before any test that uses contrast dye, seniors should have their kidney function carefully checked, and more, in some cases. There are alternative tests that don't require contrast at all. Never agree to these exams without asking questions. Your kidney health is critical to your overall well-being, and protecting your kidneys should always be a top priority after 70. Did you know about this risk? Share your thoughts in the comments. Your experience could help someone else. And stay with me, because checkup number 5 is one many people believe prevents problems, but it might actually cause serious harm to your health. Let's move on. Checkup 5. Prostate tests without a complete risk assessment. Trost testing is one of the most common exams for men after 50. But after 70, it requires extra attention and caution. Many men are sent for tests like the PSA prostate-specific antigen without a thorough evaluation of their actual risk. The problem is that PSA can show abnormalities that don't represent aggressive cancer, which can lead to a chain of tests and treatments that do more harm than good. Treatments such as surgery, radiation, and medications can cause serious side effects like urinary incontinence and sexual dysfunction, greatly impacting quality of life. That's why specialists recommend, before taking the test, it's essential to discuss the pros and cons with your doctor, review your health history, and especially consider how the results will affect your well-being. Not every PSA increase means aggressive cancer or immediate treatment is needed. Decisions should be personalized, always focusing on maintaining quality of life and avoiding unnecessary treatments. Have you ever been through this? Comment below. Your experience can help many men facing the same doubts. And with that, we've reached the end of our list of 5 health checkups you should avoid after 70 to protect your health and quality of life. If you found this content helpful, don't forget to like, subscribe, and share so more people can benefit from this information. Thanks for watching, and see you in the next Elder Longevity video.